There's 1 in 4 individuals in the US that are on Medicaid. And this is a population whose claims costs are constantly going up and up and up. And as you can imagine, if you're a health insurer, this is a pressure that keeps you up at night. What's more is that this population is very costly and they're very difficult to engage. But if you can figure out how to activate and engage these members, you have the right to then proceed to help them better their health. And we at Vheda Health, we have figured this out. My name is Shameet Luhar. I'm the CEO and one of the co-founders of Vheda Health, and we offer a digital member compliance platform specifically focused on the Medicaid population. And if I were to summarize what our company does in one sentence, it's this, which is since 2013, our company has been focused on delivering 84% member compliance and saving our Medicaid MCOs money by providing Medicaid enrollees access to an iPhone. There's 1 in 4 individuals in the US that are on Medicaid. And this is a population whose claims costs are constantly going up and up and up. And as you can imagine, if you're a health insurer, this is a pressure that keeps you up at night. What's more is that this population is very costly and they're very difficult to engage. But if you can figure out how to activate and engage these members, you have the right to then proceed to help them better their health. And we at Vheda Health, we have figured this out. We've figured out how to engage and activate this population and do so in a way that creates a sustained compliance and a lower cost. And here's how we do it. After we have identified through our member identification algorithm who the best program participants would be, we actually will reach out to those members and gain their consent for participation into one of our programs. Every member who does accept does receive a kit in the mail that looks exactly like what you see on the screen here, and it includes an iPhone along with a remote monitoring device based off of the condition that they have. Once they receive this kit, the real goal is focused on understanding how they use these devices to increase their adherence and compliance. And based off of the data that they're streaming to us in real time, our system will make a recommendation and reach out proactively to them to improve that compliance over time. Now, let's say, for example, you have hypertension and you have an elevated blood pressure. What results is a live outreach from someone on Vheda Health's health services team who will work with you to get that value back in line, part one. Second, provide a brief education of why that value is out of line and how to prevent that value from being out of line in the future. But then we'll take it one step further, which is to connect you with your PCP or your specialist so that he or she has access to this data and you're seeing that provider. Because what's most important here is that your doctor has access to this real-time remote monitoring data so that he or she can then make adjustments to your care plan, whether that's from a medication adherence perspective, if you're a diabetic, it's insulin carb ratio. At the end of the day, what we're providing is a full circle picture to ensure that that member is achieving the highest rates of compliance. And as I mentioned, we're achieving that at an 84% member compliance rate. Our platform does support multiple comorbidities. So the advantage to the health plan is that as a health plan wants to expand a program from diabetes to heart failure to maternity, et cetera, we have a platform that can support them and scale as the needs of their members are changing. Our team is a very experienced one at that. Individuals who have built payer-focused technology companies that have led to 2 successful exits, including in addition to an IPO. Myself, along with my co-founder, we were early members of Resolution Health, which was a data analytics startup that Anthem purchased for $200 million. Brad Marks, who is our chief client officer, he was an early member of Excel Health, handled their house call operations and was one of the key individuals who led their $2.4 billion acquisition to United Healthcare. And I also did want to highlight some notable investors. So as an individual who came from Anthem, we're pleased that Ken Goulet, who was my former boss, executive VP of the commercial specialty business unit at Anthem, he's an investor in our company, along with Karen Lindgren, who was a former SVP at Availity. So we have a strong team here who has allowed us to really continue to grow our business. Yeah, absolutely. So the device mix actually depends on the comorbidity. So I'll give you a use case. We talked about hypertension earlier. An individual with hypertension would receive a blood pressure cuff. Our members that have congestive heart failure would receive a blood pressure cuff, an oxygen meter, and a weight scale. We do pair all of these devices in advance to the phone. So it's essentially a plug and play kit that the member receives. So there's no member setup that's required. So just to give you an example. And then I think the second part of the question was, how do we integrate into the EMR? So part of the proceeds of our funds would be used to accelerate that capability. Right now, we do send flat files to our provider partners, but also to our health plans as a way to so that they have access to this data, plain and simple.